Buenas tardes, bienvenidos sean todos ustedes. Los saluda Nelly Cohen, directora de Amigos de la Universidad Bar ILan en México. Para la Universidad Bar ILan, más allá de la excelencia académica, es muy importante el impacto global, y a eso nos dedicamos día con día, impactando el futuro hoy. Además del firme compromiso de fortalecer la identidad judía, para que el Estado de Israel siga llenándonos de orgullo como el Estado judío. Y eso es lo que hace única a la Universidad Bar ILan de cualquier otra institución en el mundo. Los invito a conocer nuestros proyectos que están cambiando al mundo. Síganos en redes sociales como Amigos de la Universidad Bar ILan, en Facebook, Instagram, YouTube y la página web, donde también encontrarán información de nuestros siguientes eventos y podrán ver esta y otras conferencias que hemos tenido ya grabadas. Hoy nos acompañan dos grandes personalidades y nos sentimos muy honrados de tenerlos de nuevo con nosotros. Ellos son el Dr. Kably y el Profesor Edelstein. Les agradezco profundamente su participación. El Dr. Alberto Kably es fundador y pionero de la especialidad de Biología de la Reproducción en México. Tiene una trayectoria asombrosa y además en los últimos meses ha sido pieza clave para el manejo de la pandemia y toma de decisiones dentro de la comunidad judía de México. Doctor, qué honor tenerlo nuevamente con nosotros. Le pido por favor que nos hable de la situación actual.
Nelly, you're on mute.
Nelly, no se oye, estás on mute.
Ya, perdón. Le pediría al doctor Kably que nos ayude a presentar al profesor Edelstein después de hablar de la situación actual del COVID-19 y la vacuna en México, y únicamente mencionarles que el profesor Edelstein la semana pasada publicó una investigación que llevó a cabo, tuvo repercusión en todos los medios del mundo, principalmente en México y Latinoamérica, tuvo muchísima fuerza. Los invitamos a nuestras redes sociales a consultar de qué se trata. Por favor, doctor, adelante.
Gracias nuevamente, Nelly, después de un mes de no vernos. Gracias, Nati. Gracias por la invitación a los amigos de la Universidad Bar ILan en México, y ahora que tenemos presente aquí al presidente, el señor Natán Feldman, es un gusto estar aquí de nuevo con ustedes. Antes de darle la palabra y presentar al doctor Edelstein, que ustedes ya conocen, voy a tomarme unos minutos porque ha habido muchas preguntas al respecto para explicar un poco lo que se considera la situación actual en México, tanto de la pandemia global como de la vacunación en el país. Ahí pueden ver mi pantalla.
Todavía no.
Ahí. ¿No se ve? A ver. ¿No ven?
Ponle compartir pantalla.
Ya le puse. A ver. Vamos a ver.
Un momentito, por favor.
Un segundito. ¿Ahí ya se ve?
No, doctor.
A ver. Ayúdame. Déjame minimizar
Sí,
esto.
sí se veía, ¿eh? Sí se veía.
¿Sí?
Sí, yo lo vi. Ahorita no, pero hace rato cuando hablaste sí.
A ver, vamos a volver a ponerlo.
Ah, sí, sí te ves perfectamente. Tienes la mano en el labio.
Sí, yo.
Lo que no se ve es la presentación que quiere compartir el doctor.
Perdón, acabo de entrar, perdón, disculpe.
A ver. A ver, help.
Tiene que abrir primero el documento en el escritorio, doctor.
Sí, está abierto. Dice compartir.
Ahí estamos,
Ahí estoy, lo que no...
en el escritorio.
Ok. ¿Ahí la ven?
Excelente. Sí,
Bueno,
gracias.
perdón. Bueno, rápidamente, voy a presentarles algunas consideraciones estadísticas sobre la pandemia en México, sobre la base de que pues muchas cosas todos ustedes ya las conocen. En el momento actual, todos somos expertos en pandemia, todos somos expertos en epidemiología, todos somos expertos en infectología y a cada rato nos salen informaciones a veces certeras, a veces confusas, pero bueno, al final del camino voy a tratar de hacer una pequeña introducción de qué es lo que ha pasado en nuestro país. Sí quisiera comentarles que yo tengo cierta incertidumbre en el hecho de que la pandemia se haya manejado en todo el mundo de forma adecuada, en todo el mundo. Claro que fue una cosa inesperada, súbita, algo que jamás tuvimos la noción de que iba a suceder, pero la verdad es de que la respuesta de la mayor parte de los gobiernos y las autoridades de salud de parar al mundo, de dejar que el miedo superara al peligro, probablemente con el tiempo nos va a traer consecuencias de salud, de política, de economía, mucho más importantes y con una evolución más crónica que la misma pandemia. Por ejemplo, ya nos estamos dando cuenta aquí en México, en los hospitales de salubridad e incluso en los hospitales del Seguro Social y privados, cómo muchas enfermedades que se dejaron de atender durante todo el año pasado por dedicarle atención al COVID-19, ahora están resaltando y estamos viendo muchos pacientes que tuvieron un mal control de su hipertensión, su diabetes, sus tumores oncológicos, etcétera. Entonces, esto es una cosa que hay que tomar en cuenta. Otra cosa es que hay que situar a nuestro país como uno de los países de tamaño más grandes de América e incluso del mundo, que en el momento actual está presentando alrededor de 10,000 casos diarios de contagios de coronavirus. Como ven ustedes, prácticamente a partir del mes de noviembre hemos estado en un ascenso continuo en los contagios diarios que aparentemente tienen un descenso cuando se inicia la segunda semana de febrero. Veremos si esto sucede. Las estadísticas de Johns Hopkins parecen indicar que a partir de marzo nuestro país irá en descenso en cuanto a las cifras de contagio de la epidemia. Y este es el número con el que contamos ahora. El día de ayer, alrededor de 2 millones de personas que han padecido la enfermedad en el país. Esto siempre tomando en cuenta las estadísticas oficiales. Otra cuestión que es muy importante es que tenemos que ubicarnos realmente dónde estamos y cuál es la magnitud no proporcional, sino absoluta de la epidemia en México. Les voy a explicar lo que trato de decirles. En primer lugar, debemos de considerar que México es un país que tiene casi 130 millones de habitantes. Y si nosotros lo comparamos desde el punto de vista proporcional con un país, vamos a poner como Israel, estamos hablando de un territorio que tiene 15 veces más población que el otro. Entonces es muy difícil establecer comparaciones, porque probablemente cuando Israel termine, que ya será muy pronto, su campaña de vacunación, nosotros ya habremos vacunado probablemente a unos 3 o 4 millones de habitantes que corresponden al 50% de la población de Israel. Por otro lado, como ustedes, la mayor parte de ustedes lo sabe perfectamente, México es un país muy típico dentro del mapa mundial, porque es un país que tiene una alta desigualdad social y alta desigualdad social aún en pequeños grupos. Por ejemplo, el Estado de Israel cabe dentro del Estado de Chihuahua. O sea, Israel puede caber 10 o 12 veces en lo que es la extensión geográfica territorial de México. Y en México, por ejemplo, en la Ciudad de México, que contamos con alrededor de 20 a 30 millones de habitantes, dependiendo si ubican dentro de este número de población a las zonas suburbanas o a las zonas conurbadas del Estado de México, pues es un grupo en donde vive una de las personas más ricas del mundo y también tenemos a las gentes más pobres del mundo confinadas en un espacio muy pequeñito. Entonces, todo esto lo debemos de considerar. También vean ustedes, desde el punto de vista numérico, en la Ciudad de México, con casi 30 millones de habitantes, el día de ayer había 263 casos activos por cada 100,000 habitantes. Todo esto son cifras oficiales. Yo entiendo que mucha gente no acepta, y con justa razón, las cifras oficiales, pero al final del camino son las que representan la cuantificación de la epidemia en el país. Y hablar de 263 casos activos por cada 100,000 habitantes nos dan lugar, en el momento actual, a que tenemos alrededor de 53,000 casos activos por 20 millones de habitantes que vivimos en la Ciudad de México. Esto quiere decir que si nosotros pudiésemos confinar a 53,000 personas, si las metiéramos a la mitad de las gradas del Estadio Azteca, en teoría ya no tendríamos posibilidad de que existieran contagios, porque tenemos a todos confinados. Sin embargo, esto por alguna razón o no es posible o no se hace. Pasa lo mismo con la mortalidad. En México tenemos una letalidad de las más altas del mundo, que se ha ubicado desde que comenzó la pandemia entre el 7 y el 9%, teniendo en cuenta que en la mayor parte de los países es entre el 1 y el 3%. Y estas son cifras oficiales. Ya pasando al aspecto de la vacunación, como les mencionaba, y estos son datos extraídos de Our World in Data, en Israel casi el 70% de la población ha recibido una dosis, cuando menos una dosis de vacuna. Aquí en México, si ustedes ven, menos del 0.05% de la población ha recibido una dosis de vacuna. Y en los Estados Unidos, aproximadamente un 0.1% de la población ha recibido su dosis de vacuna. Aquí en México, como ustedes ven, cuando llegaron las vacunas, llegaron aproximadamente 600 o 700,000 vacunas, se pusieron en 7 días o 10 días y posteriormente ha bajado la importación de vacunas y en el momento actual prácticamente llevamos 2 semanas que no se aplican en el país. En México tenemos aproximadamente 600,000 personas vacunadas y 700,000 dosis aplicadas, porque algunos, muy poca gente, ha recibido ya sus 2 dosis. ¿Qué es lo que nos espera? En el momento actual, a pesar de que una buena parte de los médicos no hemos sido vacunados en el país, no hemos recibido ni la primera, y muchos médicos que han recibido la primera no han tenido la segunda dosis, a pesar de eso, ya se comenzó a anunciar la inmunización en los adultos mayores. Y aunque se habla de inmunizaciones masivas, aunque la palabra gubernamental dice que es masiva, la verdad es de que solamente se tienen previstas 875,000 dosis, que vienen siendo más o menos las que se deben de aplicar al 5% de la población de adultos de más de 60 años en el país. O sea, no tenemos un resguardo de dosis, cuando menos en el momento actual, para poder vacunar ni siquiera al 10% de los adultos mayores. Vean ustedes, por ejemplo, en números. En la Ciudad de México, habemos 1.5 millones de adultos mayores de 60 años. Y las vacunas que llegan entre hoy y mañana, o sea, entre domingo y lunes a México, solamente servirán para cubrir, porque son doble dosis, a 43,000 adultos mayores. Esto quiere decir que estamos muy rebasados en cuanto a la cuantificación de las vacunas. Si nosotros comparamos esto, por ejemplo, con otros países y hacemos el análisis de dosis aplicadas por día por cada 100 habitantes, vean ustedes que Israel, por ejemplo, aplica 1.23 dosis por cada 100 habitantes. Chile, que posiblemente pueda ser un espacio comparativo desde el punto de vista social y demográfico a México, tiene 0.74 por cada 100 habitantes de dosis aplicadas al día. México tiene un 0.01 de dosis aplicadas por 100 habitantes al día. Entonces, esto nos da idea de que la pandemia no solamente, si nos basamos en las dosis de vacunas aplicadas, no solamente no va a ser controlada en un plazo cercano, sino que muy probablemente quede como una enfermedad endémica dentro del país y probablemente dentro del mundo. Bien, con esta breve presentación voy a dejar de compartir pantalla. Si quieren quitármela. ¿Ya? Lina. ¿Ven? ¿Ya estamos?
Listo.
Bueno.
Le agradezco muchísimo, doctor. Fue muy interesante. Gracias de verdad.
Voy a dejar de compartir la pantalla y voy a presentar pues al profesor Michael o Mijael Edelstein, que como ustedes saben, él vive en Israel, trabaja en la Universidad de Bar ILan, es médico de salud pública, formado en el Reino Unido y especializado en enfermedades infecciosas y epidemiología en vacunas. Dentro de muchos aspectos curriculares, el doctor Edelstein es editor de la revista Epidemiology and Infection y ha formado parte del grupo de expertos de la Organización Mundial de la Salud para la prevención de enfermedades infecciosas y cuenta con más de 50 publicaciones en revistas científicas indexadas. Le doy la palabra al doctor Edelstein, por favor.
Thank you very much, Dr. Kably, for this introduction, and thank you for your overview of the situation in Mexico. I think it makes us realize that we're very lucky in Israel to have the access to the vaccines that we have, and we should remember that it's not like this everywhere in the world. I'm just going to share my screen. Hold on. Can you see my screen?
Yeah.
Okay. So, Dr. Kably, we spoke about it's just under 1 month ago. And last time we spoke, I discussed a little bit about the vaccine, the safety of the vaccine, the effectiveness of the vaccine, and the success in Israel. And I want to continue on this to talk a little bit more about the success in Israel, but also some of the challenges that we are now facing, because I think other countries, including Mexico, will face similar challenges when the time comes. I think it's a sober reminder since last time we spoke. There's been an additional 350,000 cases in Mexico and an additional 180,000 cases in Israel. As you said in your presentation, the population of Israel is much smaller, so in proportion, it's actually a much bigger increase in Israel. And you know, one of the questions that I get asked very regularly is, if you're doing so well with the vaccine program, why are you still seeing so many cases? And it's been a real challenge. We came out of our third lockdown, and the third lockdown hasn't really controlled or hasn't reduced the number of cases the same way that the previous 2 lockdowns had. So we'll talk a little bit about how we can have the situation where you have a very, very strong vaccination program and still a lot of cases. I think you showed a very similar slide, and this is just to show that Israel is one of the leaders. Well, it was the leader up to 3 days ago, but now the United Arab Emirates is vaccinating a little bit faster than us, but still, you know, one of the top 2 countries in terms of people getting vaccinated. And last time we talked a little bit about why Israel has done so well with vaccination. As you said, it's a small country. It's much easier than, you know, a state like Mexico. We also managed to, the government managed to procure a lot of doses, enough doses for everyone, really. Everyone is registered with a public healthcare system, which allows people, whether they're rich or poor, to access medical care. There's excellent data that enables to know exactly who is where and when and where they're eligible for the vaccine, so it makes things much easier. But it may be a little bit difficult to see on this graph, but things have slowed down a little bit. We started very, very well with up to 200,000 people being vaccinated every day. And now we're vaccinating about 50,000 people a day, which is still good, but not what the government would like. And this is unfortunate because the evidence that the vaccine is doing what it's supposed to do is becoming clearer and clearer by the day. What the data that is coming out of Israel and increasingly from other countries as well is that like what the clinical trials suggested, the vaccine is stopping people from being infected, is stopping people from being sick, and we're seeing a very big decrease in hospitalization and deaths in the groups that are mostly vaccinated, so the over 60s. But what we're also beginning to see, is what we were hoping for, which is that the vaccine is not just stopping people from being sick, but it actually stops infection and it stops people from infecting others, which is the best thing that you could hope for in a vaccine, and the way that most vaccines work. So if you vaccinated, not only are you protecting yourself from being unwell, but you're also protecting others from being infected. So great news. Nevertheless, the enthusiasm has slowed down. So how can we have this situation where we're seeing every day in the news how 30–40% of the population in Israel is vaccinated, and yet we're still seeing 5–6,000 cases a day, which, if you put it in proportion compared with Mexico, is actually much more. And the way to understand this is by digging a little bit deeper in the data and look at not just how many cases occur every day, but how many cases occur in which age groups and who is vaccinated. And this is what you see. If you look on the left side, you can see that among those who are over 60, the proportion of people vaccinated is very high. It's more than 80%. This is a group that is now very, very well protected against COVID through vaccination. But in the younger age groups, those under the age of 60, the proportion are much, much lower, and they're not high enough to stop transmission, and they're not high enough to protect everyone. So when you actually look at the number of cases and the number of hospital admissions by age, what you see is that if you only look at those who are well vaccinated, those over 60, the number of new cases and the number of new hospitalizations is going down very, very rapidly. And this is already 1 week old, this data that I'm showing you. And in 1 week, it's even better. I mean, the rate in this group is very, very low. And for the first time this week, there are more young people in hospital with COVID than older adults with COVID, because the older people are protected by the vaccination. But what we're seeing is in the younger age group, which is less vaccinated, you don't see this effect. You don't see this decrease because they're not vaccinated to the same extent. So this shows us that really the way to get out of this pandemic is for everyone in all age group to reach the same levels of vaccination of 80% or more that we're seeing in the over 60. And if that happens, we will start seeing decreases the same way we're seeing in the over 60 in all age groups. So this is a very useful lesson for other countries, that you cannot focus on one group to control the pandemic. You need to vaccinate everyone. And this is data that my team, my research team, is putting together, looking at not just age, but also different groups in Israel. As you know, the population in Israel is very diverse, and we have Jewish population, we have Arab populations, and within the Jewish population, we have ultra-Orthodox population and a more secular population. And these groups have different rates of vaccination. And the interesting thing is that in every age group, both the Arab population and ultra-Orthodox population is less vaccinated than the sort of general population. But what is even a little bit more concerning is that the gap is bigger and bigger as you get younger. So meaning that the younger people, whereas older people, regardless of what group they belong to, they tend to behave more similarly and get vaccinated, even though there are differences. When you get to the younger age groups, the differences become bigger, and there's less, there are less young people in proportion in the Arab and ultra-Orthodox population that get vaccinated than their counterparts in the general population. So this is something that is important, because you will need specific approaches to encourage these groups to get vaccinated. And it's not very surprising, because if you think of what happened with vaccination, it's not different from any other innovation, any new thing. You know, iPhones came into the world, and you always have a small group of people that are very, very enthusiastic about new things, whether it's iPhones or vaccination or anything. And they, you know, they are what we call the innovators or the early adopters, and they will make a special effort to try and get it. They will make a special effort to get the vaccine. And this is what we see in the early stages. What you see is that the most enthusiastic people rushing to get vaccinated. And this is why you saw this very, very rapid increase in vaccination. But once these early adopters are vaccinated, you get to the majority of the population that is, you know, they are happy to be vaccinated, but they're not going to make a special effort to do it. They will do it if it's easy for them, if their doctor is close by, if it's free, if it doesn't take too much effort. And this is a much slower phase, and this is the phase that Israel is now entering. And it does take longer. So it's not a surprise, but it means that the government in Israel cannot just cannot expect people to just keep coming. They will need to reach out in a more active way. And this scenario will happen in every country in the world. It will not be different in Mexico or anywhere else. There is another challenge, which is probably a small phenomenon, but which is a concern. And I don't know whether it exists or how big it is in Mexico. And this is the anti-vaccination movement. And this is a concern because, you know, vaccines have existed for 300 years or so. And as long as there's been vaccines, there's been anti-vaccination. People who do not want to be vaccinated, who think for one reason or another that vaccines are dangerous or part of a conspiracy of some kind. But what is different this time is that these are people, not only do they not want to be vaccinated, but they actually stop other people who want to be vaccinated from being vaccinated. And what they do in Israel is they organize themselves to book all the available appointments for vaccination, and then they don't come. So it meaning that the clinics get ready, they get the doses ready, and then nobody comes because they're fake appointments, and then they have to throw the vaccines in the bin. So now this is treated as a criminal offense, and the police are starting to arrest these people. It's very serious because they're preventing people. You know, if you don't want to be vaccinated, if you don't want to protect yourself, fine, you know. But really actively preventing others from receiving this is genuinely a criminal offense, and it is treated as such. But this is a new really a new development in the world of anti-vaccination. And another thing that is happening is people like me and my colleagues who are active on you know, on social media are starting to receive death threats to themselves and to their families if they talk positively about vaccine, which is also a very serious concern. So it's not, I wouldn't say it's the main reason for the slowing down, but it's something that's I'm quite worried about because it's a growing thing. The other thing that is complicating things a little bit is mutants, and I'm sure you heard about mutant strains, and I don't want to talk too much about it, but it's an important development in the pandemic. And the first thing to say is mutants in viruses mutate all the time. It's a normal part of evolution for viruses. Sometimes it's random, sometimes it's not random. And it happens for a variety of reasons, either because the situation changed and there's pressure on the virus to change. So, you know, maybe partly because of vaccination, because of lockdowns, it can force the virus to adapt itself, to tweak itself, to be to continue to spread. Or it could be for other all kinds of reasons, like purely by chance. If a mutation happens at the time where there's a lot of people gathered together, it can spread very quickly and become the dominant strain. And there's hundreds and hundreds of mutants and variants of COVID-19, but there are a few that have emerged that people mostly talk about. One is one that started in the United Kingdom, one is one that started in South Africa, and one is one that started in Brazil. And these are the ones that people talk about because the mutation happens to be on the part of the virus that the vaccine is able to attack. So one of the concerns is whether or not the new variants, these mutant COVID-19s, will respond, whether the vaccine will be able to neutralize them. And it seems to be that according to the latest evidence that the World Health Organization has gathered, the answer is yes, that at least for the United Kingdom variant and the South African variant, the vaccines do work, maybe a little bit less against the South African variant. But for the variant that has emerged in Brazil, it's less clear, and the studies are still ongoing. So I think this is something that we're now mostly reassured about, that it doesn't you know, negate the action of the vaccine, but it's something that the scientific community needs to watch very, very carefully. And the vaccine companies are already preparing adapted versions of the vaccines in case one strain emerges that escapes the immunity from the vaccine. So these are just a few additional points that I wanted to add from last time, because I know that these are some of the things that people are worried about. And I think it gives us a lot of time for questions, which is great.
Thank you very much, Professor. Your presentation has been wonderful. En este momento, el doctor Kably terminará de reunir todas las preguntas que tenemos pendientes. En lo que eso sucede, los invito 2 minutitos a ver este video. Gracias.
Our world is intriguing and challenging. It arouses a burning desire to understand its laws, study complex processes, discover and develop new worlds. Research is the key to understanding the world around us, to finding new solutions in wide-ranging fields. Our researchers lead some of the most important studies in Israel and around the world, in science, medicine, humanities, and energy. Learning is how we understand things in depth, discovering new worlds, revealing the secrets of the past and the present for the sake of the future. We unravel the secrets of the human brain, of human behavior, the wisdom of Judaism and heritage, creating exciting new worlds in our laboratories and clinics, impact centers and research institutes. And when we do all this with genuine passion, we earn recognition, respect, and international success. We are world leaders in cyber, in information science, and artificial intelligence. Over the years, we've won awards for research and important discoveries. We're among the academic elite in psychology, engineering, education, and the social sciences. With a spacious, award-winning green campus and thousands of students from all over Israel and every segment of society. Bar Ilan University, grooming future generations of academia, leaders leading excellence and trailblazing innovations. We invite you too to explore, discover, and to lead.
Muy bien. Bueno, pues vamos a dar, si me lo permiten, he hecho un resumen de las preguntas que con más frecuencia se hacen. Algunas de ellas, el doctor Edelstein ya las contestó, pero bueno, vamos a remarcar, Dr. Edelstein, some of the questions that I have here from the audience, many of them you have already answered, but there is one of them that is very popular, universal, the first one that everybody asks about, and it's, again, about the efficacy of the vaccines on the new forms of the virus. Can you remark something about that? Because the people is very excited about that thing.
Yes. So as I mentioned, I mean, it is one of the concerns that a strain emerges that is not covered by the vaccine. And what we've seen so far, the two most common strains, apart from the original strain, is what we call the British, well, then the strain that started in Britain and the strain that started in South Africa. And what we know from these two is that they are more infectious, so they are more likely to transmit than the original strain, which is why we're seeing in Israel, for example, where the British strain is about 50% of the cases, we're seeing it's more difficult to control using lockdowns than in previous lockdowns. However, with regards to the vaccine, it seems that all the evidence that we've seen so far for these two strains suggests that the vaccine is efficient and does stop the British strain and the South African strain. The response to the South African strain is a little bit lower, perhaps, at least with the Pfizer vaccine, but because it's very hard to know what a lower response means in terms of actual protection in real life. The consensus in the scientific community is that the vaccines are protective against the South African and the British strains, particularly the Pfizer and the Moderna vaccine. The AstraZeneca vaccine is a little bit less clear. And with the Brazilian strain, which is a third strain, which emerged in Manaus, I don't know if this was well popular in Mexico, but this is another strain that is a concern. That is ongoing, and it's still not entirely clear to what extent the vaccines are protecting against this Brazilian strain.
Okay, perfect. Another question is if you recommend a particular brand of vaccine. I don't know if you know, but in Mexico we are going to have the Russian vaccine, the China vaccine, and AstraZeneca. Then our choices are of those kind of vaccines. Do you recommend some particular in case that we can choose?
So the first thing I would say is that all the vaccines that are on the market will have been licensed, and that means that they are safe and they are effective. And in many instances, there may not be a choice. Especially initially, you may only have access to one vaccine because particular clinics, particular regions will have access to one. My recommendation is at this stage to take whatever vaccine you are offered, because there are some small differences, and I can mention some of them, but I would say that the most important thing, if you have, for example, the choice between a vaccine that is 70% effective now and a vaccine that is 90% effective in 3 months, I would take what is what you can get now, because the additional protection is less than the time you wait at additional risk. Now, if you're telling me that you are in a clinic and you have all the vaccines lined up in front of you and you can choose, that is a different scenario. What we do know, first of all, the Chinese vaccines I really don't know much about, so I'm not going to comment on. The evidence from both the Russian vaccine and the Pfizer vaccine is very high efficacy, around 92% against disease with 2 doses. It seems that the efficacy for the AstraZeneca vaccine is a little bit lower. However, there is evidence that the AstraZeneca vaccine also protects very well against infection and transmission, not only individual protection. So it may be that the individual protection is lower, but then if more people take the AstraZeneca vaccine, the population protection is higher. So actually, it's very, very hard to answer, because there are many factors. There's the individual protection and there's the indirect protection, and it depends who does what. So I think my final answer to the question is take what vaccine you are offered.
Okay, thank you. Another one, what happens if you get vaccinated while having COVID?
Okay.
And you don't know that you have it.
So probably it's not going to be unsafe, because what you're doing is trying to explain in simple terms what would happen to your body. Your body is fighting millions or tens of millions of copies of the virus, and then you're injecting this little additional bit of viral RNA. The body is barely going to notice it. So it's probably what you're going to have is you may not have the benefit from the vaccine if you're being vaccinated while you're infected. Generally, the recommendation in most countries is to wait about a month after infection to get vaccinated. We've just, I think Nati mentioned a study that we just released that I led with my team, showing that after infection, a single dose of vaccination gives you a very, very strong immune response. So the recommendation would be that after you recover, or if you didn't know that, if you didn't have symptoms, after 1 month after your positive test, that you receive another dose.
Perfect. And something that is related to this, since the full doses are already applied, can you go out with a mask? Are you still transmitting the virus to others? Can you?
So no vaccine is 100% effective. What it does is it reduces the risk of being sick by about 95% for the Pfizer vaccine and the Russian vaccine. And it reduces the risk of transmission from the evidence we have from AstraZeneca from about 70%. So while the risk is much, much lower once you're vaccinated, it is not zero. And I think especially in a country like Mexico, which realistically, it will take time to vaccinate everyone, which means that you will have this period of months where a part of the population is vaccinated, but the majority is not vaccinated, and the virus continues to circulate. At least during this time, it is advisable, and I'm sure all governments are recommending that even if you're vaccinated, you continue with the same measures that you are doing now, which is wearing a mask, social distancing, regularly washing your hands. There may be situations where you can relax these. For example, if, I don't know, you're a grandparent and you want to see, or a parent and you want to see your children and everyone is vaccinated, then it's probably okay to, it's much safer to be together, to hug, etc. But in general life, when you go outside to the shopping center or wherever, you should continue absolutely with the same measures until we're confident that the levels of disease are very low.
Okay. And how long does the immunity from the vaccine last? Do you have any date?
We don't have, well, the vaccines have only existed for about a year. So the maximum we know is about a year. So if you look at the trials, they followed patients for 8-9 months. Sorry, and they showed that after this this duration of time, people were still protected. In the study that we just released, we showed that people who were infected were after up to 10 months, they still had protection. So you could imagine that the vaccination would give you something along the same lines. But what we know from other coronaviruses is that the immunity doesn't last the entire life. Some vaccines, like measles vaccination, hepatitis A vaccination, the immunity lasts for 20, 30 years, sometimes more. We don't think that it's going to be that long for coronavirus. We don't know yet. We don't think it will be that long. It may be 2, 3, 4 years. We don't know yet.
Okay. And another question that is very common. Do you think that in a short term, we'll have a medication for treating COVID?
So there are several medications that exist. There's there's no cure, but there are medications that seriously reduces the risk of being very sick of dying if you're in hospital. One of them is a very simple drug called dexamethasone, which was discovered early on in the pandemic, which reduces the risk of death by about 30% in the most severe patients. Now there are more treatments, monoclonal antibodies, antivirals. A lot of them are coming out of Israel, actually, which again will be an additional weapon against the pandemic. But these drugs do not stop transmission. What they do is, in people who are severely ill, they reduce the chance of very serious consequences. So they can help manage the outbreak, but they cannot stop the outbreak by themselves.
Okay. And another one. If for any reason a person couldn't have the second dose after 2 months, let's say, what to do?
You get it as soon as possible. So there's no time limit after which the second dose is no good. Actually, in a sense, the more you wait, the stronger the response will be. The minimum is 21 days, according to the manufacturers, for most of the vaccines. But if you wait longer, you will still get this boost response, and you will get a better boost response. The reason to keep it close is to limit the period where you only have the protection from one dose. But if you can't get it after 1 month, get it after 2 months. And if you can't get it after 2 months, get it after 3 months.
Okay. And it's enough. You don't have to repeat.
No.
Okay. Okay. And there I have a couple more questions. One is about a special group, let's say children and young people. What about the vaccine in that kind of population?
Very good question. So the clinical trials did not include children, and the vaccine at the moment is not licensed in children. In Israel, they're vaccinated from 16 years of age, and they're thinking of extending down to 12 years of age. Below that, there really is no data we don't know whether the vaccine will work or not. It's not a question of dangerous. It's not going to be dangerous, but it may not work. And the trials are starting now in the UK with the AstraZeneca vaccine. They're just starting a trial from the age of 6. We also know that young children are much, much less likely to be severely ill. So in a sense, we're less concerned about very small children. But it is possible, especially with the mutant strains that are more transmissible and affect children more, that if you really want to completely stop the outbreak, you will need to also vaccinate children, which is why it's really important now to test the vaccines in children to see whether they will be effective in this age group.
And what about, maybe I have to respond to this question, but I want to ask to you. Sure. Can the vaccine be given to pregnant women? And another thing, if the vaccine can be a cause of infertility in a woman? or in a man?
Well, since you're a fertility expert, I will let you answer the second part, unless you want me to answer it. I will answer the first part. So what we do know from, there's two elements that are important with regards to pregnant women. The first one is there's, in the United States, they have a database of about 10,000 pregnant women who received the vaccine, and they didn't notice any additional risk either to the women themselves or to the unborn child. So from that perspective, the safety is there. The other thing to say is that pregnant women, especially in the third trimester, there is a study from the northwest of the United States, from Washington State, Seattle, that showed that if you compare pregnant women to women of the same age that are not pregnant in hospital, the pregnant women are 13 times more likely to die of COVID-19 compared with the non-pregnant. So it's really important, I think, especially for pregnant women, in the second and third trimester, to get vaccinated. In the first trimester, there's always more concerns because it's really a very important, crucial development time for the fetus. So generally, it's not recommended, not because it's dangerous, just because we don't really know. But once you're out of the first trimester, then it is recommended. As far as I know, with the fertility, I know there's a lot of rumors about fertility and the vaccine affecting fertility. As far as I know, there's no evidence to support that. But Dr. Kably, maybe you want to say more about that. It's your field of expertise.
Yes, here from my clinic, we made some summary about that. I'm going to read it in Spanish. I know that you will understand me. Okay? Que esto trata sobre si la vacuna puede causar infertilidad, tanto en hombres como mujeres, y esto está basado en comunicados hechos por el American Society of Reproductive Medicine y la Sociedad Europea de Fertilidad. Durante los últimos meses ha surgido una gran preocupación por parte de las pacientes, ya que existen rumores que las vacunas pueden causar infertilidad. La respuesta es no, debido a que el COVID-19 o la vacuna está compuesta, como ya nos ha hecho ver el doctor Edelstein, por RNA y no por virus atenuados. Actualmente se conoce bien el mecanismo de acción de las vacunas y los datos de seguridad deben brindar tranquilidad con respecto a las vacunas. Es por ello que se considera que la vacuna contra COVID-19, independientemente de la marca, no causa mayor riesgo de infertilidad. No disminuye en las mujeres la reserva de óvulos en los ovarios, ni afecta la calidad espermática en los hombres. No causa abortos, ni partos prematuros, ni muertes fetales, ni anomalías congénitas. El American Society of Reproduction Medicine y la Food and Drug Administration permiten la vacunación en personas embarazadas, como ya lo mencionó el doctor, en parejas que están en tratamientos para buscar el embarazo. Dentro de las recomendaciones europeas, no se contraponen ni se contraindica la realización de procedimientos de reproducción en pacientes que son vacunados contra COVID-19. I know that you understood me. I don't know if you agree with me.
I agree with you.
Okay. And Nelly, I think we have the resume of all the questions. If you have any other that you can say to Dr. Edelstein, if not, for me is everything. I don't know, Nelly.
Muchas gracias, doctor. Thank you very much, Professor Edelstein. Entiendo que hay más personas que se quedaron con dudas. Lamentablemente el tiempo se nos terminó. Los invito, por favor, a que nos sigan en las redes y si se quedaron con alguna pregunta, envíenla y con mucho gusto haré la labor de mandar al profesor Edelstein y nos la pueda responder. Professor, it has been such an honor to have you twice with Amigos de Bar ILan en México. Thank you very, very much. Dr. Kably, un verdadero placer compartir esta experiencia con usted por segunda vez. Le agradezco honestamente su apoyo y su participación. Antes de que se vayan, les quiero compartir que el 15 de marzo tendremos otra conferencia espectacular con el tema del Día Internacional de la Mujer. Nos va a acompañar la doctora Efrat Levi-Lahad, ganadora del prestigioso premio Emet del Hospital Shaare Zedek, y por parte de la Universidad Bar ILan nos va a acompañar la profesora Orna Sazón Leví, consejera del presidente Ariet Saban de la Universidad Bar ILan, con especialidad en el tema de género. Ella es experta también en el tema de la mujer en el ejército. Va a ser una conferencia muy enriquecedora. Los invitamos a todos y a todas a que nos acompañen, por favor. Muchas gracias y que tengan muy bonito domingo.
Gracias.
Muchas gracias.
Thank you. Muchas gracias.
Gracias, profesor.